fine motor ability to push a button to call for the nurse. And so we need to, number one, make sure that we have that access for patients to call for help and get their attention, get our attention when they need it. Also, when we think of someone who's ventilator in the ICU, they're coming out of sedation and they can't really move their body very well. They might be disoriented. They might be experiencing delirium and impact their communication. As you said, those who are deaf or hard of hearing, or some patients need glasses to see their environment, to see who's talking with them. And those glasses, we have no idea where they are in the room, and we're scrambling and looking through all of their patient belongings. So many times a nurse or someone will say to me, "My patient is so confused." And then I put their hearing aids on or their glasses on, and the confusion all of a sudden just disappears.
What you're talking about really is all of the senses, hearing and seeing and, what do I say, seeing, hearing, tasting, touching, all the senses that feed in to our body, to our brain, that help us formulate an understanding of what's going on around us and allow us to then communicate back. All of those senses can be impacted in the ICU. We also know that ICUs are very noisy places, very busy places, lots of beeps and sounds and things, and that must impact communication too, because of overwhelming our hearing system, even if we're not hard of hearing. You're listening to Dr. Radio on Sirius XM Channel 110. This is the Rehab Show. I'm Dr. Jonathan Whiting, one of the professors of rehab medicine. Tammy Altschuler is my guest right now. Tammy is a speech-language pathologist and a specialist in patient-provider communication in the Department of Speech-Language Pathology here at NYU Langone Rusk Rehabilitation. We're talking about how do patients and providers communicate best. Tammy has outlined that clearly this is a patient safety and quality and outcome issue. If we can't communicate well backwards and forwards, how can we get the best for the patient? So this is something really important. And when we look at the ICU, and certainly look at it right now with COVID-19, this is an area of significant concern. If you yourself have had issues with patient-provider communication, or you have a loved one who's in the hospital right now and you're concerned about how they're getting their point across or communication with the team, if you have a comment or a question, join our conversation. Call in. Give us a call, 1-877-NYU-DOCS. That's 1-877-698-3627. We're happy to hear your thoughts and questions and steer you in the right direction. You can also email us, docs@SiriusXM.com. We're happy to take your calls or your emails. So Tammy, we talked a little bit about patient issues with communication. What about providers? What are their barriers? I'm going to say one. I can think of one. The providers are so busy. They're running all over the place. Maybe they feel they don't have the time to stay and to communicate and to understand and hear patients. But other than sort of their time and they're so busy, what are some of the other provider issues that impact patient-provider communication?
I think right now in the time of COVID, I've noticed my own communication breakdowns, even provider to provider. We're all wearing this PPE with all these masks on. There's so many times that I'll see someone in the hospital and not recognize immediately because I just don't see their face, and it takes a few seconds for me to know who even I'm speaking with. So when we go into the room, you can imagine what a breakdown that could be between us and the patient. Also, our speech is really impacted by wearing these masks. So I feel like I'm yelling at people, if I'm yelling at the patient or another provider, because the sound is muffled and people can't really hear me as well. Like you said, we're also rushed right now, and we're spending the same amount of time in the room with the patient, probably, but we're reducing the trips into the room because of all the PPE that's required, and the downing and dousing takes such a long time. So we're separated from our patients. We're not always right in the room with them when we need to be. And that's a huge barrier for communication. And once again, we're putting that on the patient to hopefully remember everything that they need to ask for in the moment and capture, really maximize the moment that we're in there at the bedside with them.
That's a very interesting thing to bring up because, the fewer visits and the separation between provider and patient. And it's true, in a sense, we try to limit the communication or the contact, should I say, to try to slow or prevent the spread of this virus. I know when people come to see me in the outpatient office, they're anxious, they're nervous, they forget most of what they wanted to ask me. It's really a struggle on my part to help people settle and calm and take the time for me to give them the time, to provide the time so that they can relax and can communicate what they need to say. As you said, the ICU is such an anxiety place for patients, and many of them aren't feeling well at all, and with fewer visits they're less able to communicate what they need to in that time. Such a challenge, such an incredible challenge. So we understand, Tammy, that there's two sides to this. There's the patient and their issues and the provider and their issues, and this environment really leads to a situation that could portend poor outcomes. As you said, patient-provider communication impacts outcomes in terms of quality of care, successful management, really very with the solutions. How have you and your team, not just at NYU but nationally, how have you overcome this issue? What are some of the solutions to the challenges and barriers that limit or impact patient-provider communication?
About 6 weeks ago, which now feels like a lifetime ago, or 6 years ago,
That's right.
a colleague reached out to about 11 other speech-language pathologists, nursing leaders, and engineers throughout the country, and realized with COVID-19 and the respiratory distress that we're seeing with patients, a lot of people who need breathing tubes and then won't be able to speak. So we got together really fast and created a large amount of tools, free resources, communication boards, with some are alphabet boards, some are picture communication boards, some are medical decision-making boards, because unfortunately some of our patients are making end-of-life or life-sustaining treatment decisions right now, and they need to have a way to ask the right questions to guide them through that process. We have tools that we've created in multiple languages. Not everyone speaks or writes in English, especially in New York City. And these tools are all available. I'm putting a little shameless plug out there, but they're all available for free on patientprovidercommunication.org. And in addition to the tools, we created some strategies and tips for providers to learn how to better communicate with our patients.
Yeah, it's interesting. We think that this comes naturally to human beings or to doctors and nurses. To some, it comes maybe more natural than to others. Under pressured situations, I can imagine, and I've experienced myself, and I'm sure you have as well, that communication can sometimes dry up through our own fear, through our own anxiety, through our own stress. And we need training. It's very interesting that you can train people to communicate better. So that's very, very important. So let's just go over again, Tammy, because I think this is so vital and so crucial that we understand this. Some of the tools that you're using. So a communication board, what does that look like? Is that a manual board? Is it electronic? Is it an iPad? Are we digital? How does that work, a communication board?
There's a large spectrum of what a communication tool or support can look like. So we can go from really high-tech to a $15,000 high-tech speech-generating eye gaze device to something very basic, which is a communication board, which could be just a piece of paper. And you can write the words yes, no, maybe on that, and there's a communication board. Anyone can make a communication board. You don't need fancy pictures or wonderful graphics to do this. And so the patient would utilize the board by either pointing to different letters to spell out words or pointing to pictures which convey the meaning of what they need or want. And not all of our patients can point either, so we created instructions that would go on the back of the communication board that help someone do something called partner-assisted scanning, which I'm using a lot with patients who are on the ventilators because they're too weak to point to the communication board. And we're really highlighting what the options are for patients, what the messages or the letters are, and they give a signal when we read aloud what those are. They can give us a thumbs up or maybe a head nod to let us know that we've reached the target for them.
Yeah, this is really, this helps us get such insight in terms of the environment inside the intensive care unit. I want to remind our listeners that NYU typically has 15, medical ICU beds normally, where, most of them have people who are on ventilators, and just like Tammy is describing, they have trouble or difficulty communicating. And our hospital, all members, both from intensivist physicians as well as nurses and therapists, people like Tammy, speech-language pathologists and experts in patient-provider communication, we're staffed to that number. We've had as many as 175 patients on ventilators around the hospital in an intensive care environment. So imagine the kind of work. Tammy, I doubt you've slept in 6 weeks. I can't imagine that you and your team have had a chance to really wind down, because every single one of these patients has issues with communication. To that end, I know you can't do this all yourself. How do you train people? You mentioned about provider.com, is that right? Patientprovidercommunication.org as a site where there's educational material. But how have you managed the education of our providers in the hospital?
I find that what works best is on-the-spot training. So little impactors right